our healthcare system as it is, it's not firing on all 8 cylinders, so to say. We have significant problems. We have in the province of Ontario this term you may have heard of, hallway healthcare. We have long wait times. We have inefficiencies in our system.
Hello, everyone. Welcome to VMB podcast. That's number 6. Dr. Sabharwal. I love the journey here. I think it's growing. I feel like we're getting across to people. We're emotionally touching people. As I mentioned in our last podcast, there's been a lot of people reaching out. We got messages flooding. People are really appreciating what we're putting out there. And that really uplifts me and motivates me. Because I think the intent to do this with you was to reach more people and, use a little bit of wisdom that I had. You have a lot more. Just to, get across to people and see how we can help them.
Absolutely, for sure.
So we got an interesting topic today. What do you think it is? No idea.
No clue.
All right, so it's up your alley. Let's talk about healthcare today.
Excellent. Beautiful topic.
And healthcare is so vast. I really want to narrow it down on several different topics, but we'll start from a grander overview, and we'll hone in on exactly what we want to talk about.
Absolutely.
Cool. How do you feel about the healthcare in Canada and Ontario, in particular municipal communities, Brampton, Vaughan? What is the overall spectrum? What do you feel where our healthcare system really stands right?
Well, in as far as our healthcare system, I could say one thing that our institutions, which teach healthcare, which teach medical, dental, pharmaceutical science, nursing sciences, and all that.
Yeah,
those are perhaps the best in the world, without a doubt.
I would second that.
Our professionals here, whether they're doctors, whether they're dentists, whether they're nurses, whether they're assistants, whether there's auxiliary staff, within Canada, by far the best in the world.
Right.
However, and it's unfortunate that I have to say this whatever, is that our healthcare system as it is, it's not firing on all 8 cylinders, so to say.
Please elaborate.
We have significant problems.
Okay.
We have in the province of Ontario this term you may have heard of, hallway healthcare.
Oh God, yes.
We have long wait times.
Yes.
We have inefficiencies in our system. We have good meaning doctors. We have good meaning teams. We have good meaning staff. But we do not have a system where we are efficient in the delivery of optimal healthcare.
That's something I definitely agree with you, because my father, over the last 8 months or so, has been in and out of the hospital. I'm very thankful and humbled by our medical staff at all these hospitals. But the times, wait times, hallway healthcare, I didn't know what it was till I actually experienced it myself in my own 2 eyes. And the wait time, like I said, because you can't blame doctors, you can't blame nurses. They're doing their very best with what they had and what they're working with. But we have limited doctors, we have limited beds. And I remember my father was in the emergency, admitted to the hospital for like 5 days in his last visit because they didn't have beds. And then they transferred him to beds for 3 days out of that 8-day journey. And I just felt bad because I saw people just lying there in the hallway and they needed to be addressed. Those patients had severe conditions. And when you have them in the hallway, you're exposing them to so many other virals,
other ailments, or what's called in the world of medicine, nosocomial infections which a person does not come in with, but because they're in an environment where there's many more people, they can pick something up.
So imagine that. Like, they've gone from one condition to become multiple conditions. So I agree with you. With what you said about hallway healthcare, with the wait times.
But how do you address this? Well, first of all, we don't have enough. You were talking about doctors.
Yes.
We don't have enough nurses. We don't have enough personal support workers. We don't have enough people to meet the demand that Canadians have on the healthcare system. Canadians are getting older.
Yes.
And unfortunately, with age come certain ailments. And therefore, you do need healthcare. We don't have enough hospitals. If you don't have enough hospitals, you're going to have enough hospital beds. So first, you need the infrastructure. You need the people to work within that infrastructure. Do you know that in the province of Ontario, that some emergency rooms had to close their doors?
I'm not aware.
The Globe and Mail recently published an article with regards to that.
Why is it?
Some scheduled maintenance, okay, you understand that. But sometimes lack of staff. In a remote area, if you only have 2 people and they get ill, how can that department run?
So you're saying that we're already scarced on these resources.
The resources.
And now you're saying that they're shutting down over it? Like,
Yeah, they're my involved since emergency rooms are shut down for the weekend, shut down for the long weekend, shut down for a certain period of time.
wow.
Very disheartening, right? But that's the reality. Where do we start addressing this? Well, first of all, we address it, but where do we want to go? Where is it that we want to be?
I mean, as Canadians, I think medical needs has become a welcoming factor of all immigrants. Like where, Canadians have come in knowing that the medical system is very supported and funded within the Canadian world. So now with what I'm hearing from you, it's already in limitation.
Absolutely. And if we do not make fundamental shifts in the way we deliver healthcare,
Yeah.
in the infrastructure we have to deliver healthcare, and for the personnel who are responsible for delivering that healthcare, our crisis will only get worse and will only deepen. Our population is aging. That is a fact. We cannot change that fact.
So let me pull you away from this for 1 second. It's not off topic. It's 100% relevant. You run several dental practices.
I do.
I want to treat this operation as you're a government on your own.
Okay.
You're funding these locations. You're hiring doctors or dentists, for better language. You hire
dental assistants, right? And receptionists, auxiliary team, and have other teams such as
market branding.
Yes.
Right. There's a lot of expense coming down. How have you managed to, in such a short time, grow these dental practices? Because if immigration is hitting hospitals, immigration is also hitting your dental clinics. People might say that dental clinics are privatized, but you're putting all the investments to upkeep with the growing population. So what are you doing that's very different from hospitals where,
I personally think that that's not a fair comparison.
Why not?
It's not a fair comparison because as a dental clinic, I am there. Our business model is obviously to serve the needs of the patients who choose to visit our clinics. And there are a number of choices patients have when it comes to getting their oral healthcare needs taken care of by virtue of the fact that there are a lot of private clinics in a place like the GTA where my clinics are. Healthcare, on the other hand, it's not a private business. It is a government-run service provided to Canadians for their betterment of for their healthcare needs. Now, in cities such as Toronto, Ottawa, London, Ontario, in those places, because there's universities there, because there's a significant amount of population there, in those areas, there are many more hospitals and so on and so forth, right? But there's remote areas, okay, where there's a population of people who need healthcare, but there's no hospitals there. There's no, and if there are hospitals there, they're very small. They're staffed. There's a lot of issues there. Comparing the private sector to the public sector is number one. I don't believe it's a fair comparison.
Okay.
Secondly, we have to understand that when you're running your enterprise as a business, as opposed to the government running it as a service for the population, what's your end goal? For us, our end goal is not only to treat our patients, but we have to stay afloat,
Right.
which means we have to find efficiencies, which means we can't have redundancy, which means that when we do a procedure, we need to hit a fairly high threshold of success. Is that true in the world of healthcare? But, and that's just probably not. Why not? Because the government has to start treating some aspect of healthcare as a business to find the efficiencies, not to find profits, but to find efficiencies.
All right. So let me break this down. We spoke about immigration in our last podcast. Yes, we did. Right? We spoke about infrastructure in our last podcast. If you take infrastructure with, per se, immigration, and you talk about hospitals, I'm just going to pick on Brampton for a second. Brampton is a great city. They've got one hospital, enormous population, right? They got a large population, one hospital, and they're not able to meet people's needs and requirements. That is a very large hospital, but as I'm getting to that, so they have a lot of things in-house. I think we should take a tour. We should take our media team, take a tour of these hospitals. What we're talking about is only going to be understandable if either you visited the hospital or your family's been ill or visited the hospital. Because when people talk about hallway healthcare, immigration, infrastructure, limited beds, limited doctors, limited nurses, you won't know this experience till you go and see with your own two eyes what's really going on here. I genuinely feel bad for the medical staff, but you being in the medical field, throw out some solutions.
Well, the solutions are, again, you're going to have to reverse engineer this. We know where we are. We know our problems. We need to hire the best minds out there.
Yes.
To, first of all, give us the data. What is the raw data of what type of ailments are coming into our hospitals? Where are those bottlenecks that we have in our hospital system? We've got to identify this.
And that's what we want to. But there's so much experts in the system already, is it? Is it not very evident with all the staff that existed that we have all these? It is, and why is it not being addressed?
It is, but does that staff have an opportunity to give meaningful feedback to the higher ups and the hospital boards to say this is the problem in the hospital and this is how we have to identify it?
So why is it not being done?
Well, perhaps it is. It's not that it's not being done. It's just not being implemented.
But that's what I'm saying. A city like Brampton having one hospital, Mississauga, these are some of the highest paying cities in taxes, and yet again the resources are limited. And if this is how it is now, it's only going to get worse.
It's going to get worse until and unless we decide where we are, where we want to go. Until we don't do those calculations, until we don't figure stuff out, it's going to stay that way. What has to be done is you have to realize our population is aging. So because they're aging, they're going to need more healthcare. Where do we invest? Now, if you just invest in the infrastructure, you get all the hospitals, who's going to staff them?
So then I'm going to push back, and I've got a question for you. Tomorrow, things change, and you're put in this position,
Okay.
to be a health minister for the province of Ontario.
Okay.
How will you change our broken system? Irrelevant of the government. I'm just really just throwing that out there because I feel that you have the knowledge, but we definitely need implementation. And what do?
If I was the Minister of Health, the first thing I would do is I would go out and find the smartest minds who are in the field of medicine, who are practicing doctors, who have a minimum experience of at least 10 years. I don't want academics. I don't want people who are not on the ground. We would set up a think tank with them, okay, where we will identify the issues.
So these are people working.
These are people who are in the hospitals, in everyday healthcare.
Okay.
Then I would also, not only doctors, nurses, auxiliary staff, reception staff which knows the problems because they see it day in, day out, day out.
Yes.
From there, we would identify all the issues. Once we have the issues, we will then have to create some sort of a mathematical model to figure out, okay, is this where we are today, given our current population, given out the current age of our patient cohort, given that we are going to increase in population, where are we going to be 10 years down the road, 15 years down the road, 20 years down the road in terms of demand? Now I know what the problems are. Now I know where the disease process or which diseases and which ailments are going to require attention. And then I'm going to know which area where we are going to be placed 20 years from now. Okay, now I'm going to reverse engineer and I'm going to make sure that we have the infrastructure. I'm going to have a dialogue, a meaningful dialogue with all the universities and educational institutes which are bringing in medical doctors, dental doctors, nurses, pharmacists, assistants, all those people which make that institution run. And then I would go to the government and say, listen, for me to fulfill, not only get the infrastructure ready, I need X amount of dollars. I need X amount of people vis-a-vis your immigration policy. So we would change immigration policy so we can bring immigrants to this country who instead come here or trained professionals, doctors practicing in their countries, nurses practicing in their countries. Instead of having such a high barrier to entry, if you have experience, real world experience where you are, you're going to use that experience in lieu of passing all these exams, and you're going to come and work in our system. It has to be reverse engineered. You need the brightest minds. You need the data. The data never lies. Anecdotal evidence does. Data doesn't. You need people who are on the ground. You need to know exactly what is happening. And from there, you have to form a 20-year plan.
Right.
That's what I would do.
I think your thought process is great behind this. Because I don't know, again, for me, this wasn't a government-related question. It was more of, I've gone through that experience with my father multiple times, even from a hospital perspective. And I don't care what anybody says. And this is on record. Our medical system is broken. And nobody that I want to point that finger at. But how does any government overlook this?
You need a political will to change it. In order for you to have that political will, you need acknowledgement. You've got to acknowledge there's a problem.
Right.
If you acknowledge there's a problem, instead of ignoring the issue, you must identify it.
Right.
The Canadian people are very smart. If there's a problem, then have the guts to say there's a problem and have the political will to want to change and solve that problem.
But that is my problem. We keep voting the same way. We keep voting the same patterns. Nothing changes. I'm telling you, I had zero political interest. My interest is for the betterment of Canadians in all aspects. Absolutely. And I think that is the reason you and I have looked at this podcast. It's a way to communicate with the youth, the seniors, the everyday average Canadian.
Absolutely.
And how do you get a message across to them? Through digital media.
Absolutely. It also means
with ban on media channel, there's such limited information that can be given out. It's a great way. And what you just said, having a 20-year plan, why isn't any government looking at it? This is mind-boggling. It's disturbing.
I don't know if any government is looking at it or isn't looking at it, but that's what a government needs to look at. It needs to look at a far vision, a non-electoral cycle vision, a 20-year plan where great nations become great when they have grand visions.
Right.
Healthcare, having great healthcare, it's not a vision. It's a necessity. It's a requirement. It's a requirement. Canadians deserve the best that they can get in healthcare.
And they definitely deserve better now than they currently have.
And the demands are going to be higher on the system.
That's my problem. With my father's experience a week ago, things are only going to get worse. Right? Like, I'm telling you, I want every single, and this is my appeal to any sitting minister, any sitting politician, go make a visit to the hospitals and tell me that our system is now broken.
Listen, when you have an appeal
Yes.
to sitting MPs, MPPs to visit the hospital, I urge them to visit the hospital not as an MP or an MPP. Visit the hospital as a normal, everyday Canadian would visit it. Then you will see the problem. Then you will see that this problem is a real problem. I'm very happy to say that there are some patients who have had nothing other than an exceptional positive experience at the hospitals. I want that, and I need that, and I hope that is not a one-off.
Yeah.
I hope that is the norm, not the exception.
I'm telling you, again, the medical staff, doctors, nurses, anybody. That whole amazing, like they put in so many hours, but the resources are so limited. Can you really,
Vrind, I believe what we need to do in order to further, I think this is a very important topic, not only for Ontarians, but Canadians in general. I believe what we need to do is we need to bring doctors into our podcasts and listen from them. Okay, let's listen straight from the source what they believe the solutions are.
perfect. And let's bring in some ministers as well. Let's bring in some MPs as well. We'll sit down, have a conversation with them.
And again, I want to be very clear. This is not to point or blame Vigor. This is our country. And if we can collectively help to make it better, then we're doing our jobs as citizens of Canada.
Here's what I think. They might be able to tell us, for example, the Minister of Health, Kearney, might be able to tell us things we don't know that they're already doing. And that might get great for somebody like myself who had taken my father to know that, hey, this experience was like this, but we've got so much work that we're doing in the pipeline, right, that it takes time, and totally understandable. But I would love to hear that.
We need that conversation. I think we should definitely bring some people who are, as we say in the surgery of wet-fingered surgeons or wet-fingered dentists, meaning that they actually are in the field doing what they practice. And let's hear from them. We will get lots of insight.
I just thought they were in the rain too much. That's right. Now here's another question for you. As we're really zoning in on this. You have been in the medical world for what, 20 odd years now?
24 years.
24 years. How has healthcare changed in those 20 years? How was it then? How is it now? Maybe some masala in between, like what's going on?
Well, I could talk about dental health because I'm a dental surgeon.
Yes.
Dentistry has definitely changed in that dentistry has introduced a lot more techniques, a lot more efficiencies, visibility scanning technology, digital x-rays, more treatment modalities, so on and so forth. Implants in the past were certain things that very few did. Now it's for the masses. And what has happened most interestingly in Canada is the introduction of the CDCP, or the Canada Dental Care Plan. Now, this is a plan implemented by the federal government.
Yes.
For optimal health care.
Yes.
And it is to allow Canadians who earn less than $90,000 a year to have basic dental care covered for them.
Yes.
Excellent plan.
It's a great initiative.
Before this plan was implemented, it was estimated that over 9 million Canadians would not visit the dentist. It was expensive. It was horrible. It was expensive. Very, very difficult, especially when you're on a limited income.
Yes.
Given the fact that dental care, quality dental care, there is a price for it. we cannot say that it is extremely affordable. It's necessary, but sometimes people have had to make the tough choice that are they going to pay their bills? Are they going to pay the rent? Or are they going to go and take care of that sensitivity or that aching tooth? And unfortunately, many Canadians have had to make the choice where their oral health was put on the sidelines for other personal reasons.
Right.
The Canada Dental Care Plan has definitely been something which Canadians should be proud of. I believe that the plan its spirit is very good. Like everything which starts in the beginning, it has had some pickups. In particular, there was an article in CBC saying that close to half of something called a predetermination for complex dental cases were being rejected, and the wait times for us to hear back whether a certain procedure is covered or not under the CECP was extremely long. That's being changed. That's being improved, which is a good sign. Are there many more things we have to do to improve this system? Absolutely. But in Canada, what the federal government has done in as far as dental care, it's done something very, very, very good, because a lot of people, for their dental ailments, for dental emergencies, would actually go to hospitals to have that taken care. And at the hospital, many hospitals, a majority of hospitals don't have a dental department. So you would waste time at the emergency. You would exhaust resources from the medical system without getting a proper cure. That has been curtailed, or at least a lot of it has been curtailed. So I think it's a wonderful plot. It's a relatively new plot. I just hope that the government will find ways to make sure that this plan does not suffer the fate that other governmental run plans have had. Right. And this is a very important topic, in my opinion. In the province of Ontario, before the CDCP, and still now, there's certain lands which the government of Ontario offers to low-income people of Ontario, and it also offers this plan for those people with disability and the children of those individuals who have certain financial constraints. The issue with those plans is that those plans, as good as they are in spirit, the compensation given has never kept up pace with inflation.
Right.
So something which was implemented 10, 15, 20, 30 years ago, and it paid at a rate which was fair at that time, it hasn't kept pace. And dentists in the province of Ontario who accept patients on plans like Ontario Disability or Ontario Works, they are having to either make no profit whatsoever or actually compensate out of their pocket to take care of these patients. And I'm so proud to say that a majority of dentists in Ontario, regardless of the fact that it's a financial loss for them, they still, in good faith and in the professionalism that my colleagues exhibit, they take on these patients. Wow. But if the CDCP falls trap to not keeping up with inflation, as good as this plan is today, 10 years down the road, there's going to be people who are going to dentists are going to walk away from it.
The honorary. Oh, wow. So, I mean, health is, I think you and I, when we talk about health, we can go on for hours and hours because it's such a broad segment.
Absolutely. And it's hard for every Canadian.
Yes. I think with this being said, with this particular topic, I want to wrap up here. Because we've touched hospitals, we've touched limited resources, limited doctors, we've touched dentistry, and there's so much more that I want to touch, but we could sit here all night.
Well, let's get experts from the field.
Done. So I'm going to hold you to that. I'm going to get you to reach out to colleagues of yourself and doctors, family physicians, surgeons. I'm going to reach out to politicians that are my friends. They're in the political body. They're working hard, like all across all party lines. I know they're working hard. I just want to understand what is it that's missing and where will we support.
Let's get a solution. That's kind of your one,
Right? And I think that's what's needed. Right? I'm looking straight at the camera. I have nothing to gain from this, but betterment of Canadians, of our Canadians, of my fellow Canadians. That is really it. I have no intent other than that. But I think your intent is very similar.
Absolutely.
So for a better Canada, guys, I'm going to invite you get all hunky-dory our podcast, but
For a better and healthier Canada.
for a better and healthier Canada, I think let's create future steps and work together on this particular segment, elaborate further. Thank you so much, guys, for tuning in. Thank you, Dr. Sabharwal.
Thank you, Vrind. Thank you, everyone.
Thank you, guys.